Hi, good morning. I'm Dr. Sonia Angell. I'm Director of the California Department of Public Health and State Public Health Officer, and I'm welcoming you all today here to our Medical Health Coordination Center. This is where we coordinate with all of our agencies a very important response that we've put in place for novel coronavirus, otherwise known as COVID-19. Novel coronavirus, COVID-19, is new, but it is part of a family of coronaviruses that have been around for a long time that we are very familiar with. In fact, coronaviruses are responsible for the common cold, so it's something that all of you may also be quite familiar with. The cause of the current outbreak that originated in China is a new member of this family. The most common symptoms of COVID-19 include fever, cough, and shortness of breath. Our experience to date, though, is that most people, more than 85%, will have mild or no symptoms. Some may move to a more complicated course, including pneumonia, but that is not the most common manifestation of novel coronavirus. We're learning more about its transmission, and as I said, the most common symptoms are respiratory. Therefore, its primary mode of transmission is from coughing or sneezing, particularly when we don't cover our mouths after we sneeze or cough or don't wash our hands. There have been a limited number of confirmed cases of COVID-19 in California to date, as mentioned. 33 positive cases in California, 24 were from the repatriation flights. The other 9 confirmed cases include 7 that are travel-related, 1 due to person-to-person contact, but that was from a very close contact, a spouse living in the home, and now, as mentioned yesterday, this new case from an unknown source. This particular case could be the first possible instance of community transmission of COVID-19 in the United States, and it's here in California. It's in an individual in Solano County who is receiving care in Sacramento County with no travel history and no known exposure to somebody with confirmed COVID-19. We currently have people in the field working in the community at the local, from the state, and also from the CDC. They're investigating the cases and they're taking action. They're contacting any individuals who might have been exposed and they're isolating them. This is a fluid situation at this time, and I want to emphasize that the risk to the general public remains low. In the event that that risk changes, we will communicate with you. We will make everyone aware. But it's important to note that the risk to the general public in California remains low from novel coronavirus. The Department of Public Health's Emergency Operations Center has been actively coordinating response efforts, preparing for possible community transmission. As always in emergencies, we plan for both the worst situation, but also the best situation. So we're ready for anything. We've been working with our state and local partners for situations like this for over a decade. We've updated our plans based upon our lessons that we learned from H1N1 and from Ebola virus. But we do realize that this case that we're discussing today marks a turning point. And as such, we're expanding our surveillance activities. We're increasing our laboratory capacity, as mentioned, with more testing. We're planning increased demands on our medical system. And we're using the latest science to model and forecast the needs of our community so that we are sure we can continue to respond as we have to date. As we learn more about COVID-19 and how it evolves, we will be sure that we adapt whatever we're doing to make sure that our responses are appropriate. And as we continue to work in coordination with federal and local partners, there are some simple steps that I want to remind all of you, we'll all emphasize this, that you can do today to make sure that you stay safe and to protect yourself. And those include washing your hands with soap and water, avoiding touching your eyes, nose, or mouth with unwashed hands, staying at home from work or school if you become sick with respiratory symptoms like a fever or cough, and avoiding close contact with people who are sick. It's natural to be concerned at times like this, which is why California officials have been closely monitoring and working with partners around this situation. Now I'd like to turn this over to California Office of Emergency Services Director Mark Ghilarducci.